Hello, I'm Dr. David Levine. Today's date is May 24th, 2025, and I'm at the Lost Pines Resort in Austin, Texas for the American Association of Plastic Surgeons meetings, where I'm conducting interviews for the ICON Project. The purpose of the ICON Project and these interviews is to preserve in an audiovisual format icons of our society who are teachers, innovators, forward thinkers, and great surgeons who advanced our specialty to where it is today. I hope you enjoy this. Hello and welcome back. I'm Dr. David Levine, and I'm here to interview Dr. Robert Havlik as part of the ICON Project. Dr. Havlik, nice to see you. I told you I'm going to start out with some simple questions. They get a little bit more in depth.
Okay.
But would you state your full name and date of birth?
Robert John Havlik. I was born on October 15th, 1958.
Okay. And what were your parents' names?
My father's name was Norman, and my mother's name was Jessie.
Okay. And you told me you were born in
Detroit.
Detroit.
Yeah,
Okay.
grew up in Detroit. Yeah.
Okay. Now, how many children or grandchildren do you have?
I have two children.
Okay.
Yes. One of them is currently a psychiatry resident at Stanford, and my daughter works for CDC.
Okay. And she's still got a job.
So far.
Knock on wood.
Nah.
You never know.
Yes.
The people that might see this at some point won't understand that little inside joke.
Right.
How did you meet your wife? Or are you married? I guess I should have
I'm
answered.
married and have been married for 32 years. And I met her actually. She was an intern at Yale, and I was a chief resident in surgery at Yale.
Okay.
And there was a patient who had a necrotizing infection, and I was asked to consult on the patient. And we met at that point in time. And things.
Well, I could think of more romantic
Yes.
ways to meet your wife, but I met mine on Match.
Is that right? Okay.
Yeah.
Okay.
But okay, so she was an intern
She was an intern in surgery.
Okay, general surgery.
In medicine, and then went on. She did her dermatology residency in the Harvard programs.
Okay. All right, wonderful.
Yeah.
Well, tell me a little bit now, we get a little more in depth, what's inspired you to go into plastic surgery? And tell me about your mentors.
I'd love to. Actually, I ended up in plastic surgery sort of as an accident. I had always considered plastic surgery and had worked with the plastic surgeons at Yale when I was a general surgery resident. And I was initially going to start to do cardiac surgery. And then I just didn't like the field. There was not enough patient contact for me. And so what happened was that I kind of was going through general surgery resident and every other night program, on-call program, and I was trying to sort things out. And I did pediatric surgery, and I was going to apply in pediatric surgery, but the problem was I was late because it was the last rotation I did as a fourth-year resident. So I figured if I'm going to apply in pediatric plastic surgery, then what I'm going to do is I'm going to take 2 years off, and I'm going to get a master's in health service administration because I had always had an interest in health policy. And so I took the GMATs, the qualifying exam, and was accepted and had everything all set. Everything was all set. I was ready to go for position in pediatric surgery. I had secured a place in the business school at Yale. I had set up a lab, and I was going to attend one day a week as a general surgery resident to help fund all this, okay? And then what happened was that the very last week of my general surgery residency, after 5 years, the person who was going to take the plastic surgery position was an attending ENT surgeon from Massachusetts Eye and Ear. Okay. And he came and I took him around and showed him the VA and the kind of cases that we had been doing in a very supportive way. And he went through this, and I think he got a little scared because the next day, Steve Arian, who was the chief of plastic surgery at that time, called me and said, "Do you want to do plastic surgery?"
Wow.
Yes.
So you were just at the right place at the right time.
Right, right.
But you obviously had an attraction to the field itself.
Well, I went through and I said to Steve Arian, I said, well, if you can give me a week, I'll give it some thought. And really what I thought about was that in plastic surgery, I could provide both pediatric care and adult care. And that was very attractive to me. And so I decided instead of going to business school, I was going to carry on in plastic surgery.
Okay, but so interesting, because I would not think of pediatric surgery as a big section of plastic surgery.
Yeah.
But obviously it is. It's just something I hadn't thought about. I mean, the facial part I get,
Yeah.
but there are other things too that I don't think much about that would, be involved in that field, and that's obviously a love of yours.
Right. It definitely is, and I definitely practiced for many years after that in primarily pediatric plastic surgery and loved it. So I found it very gratifying work.
Okay, well, when I said your mentors, so who were the mentors that led you to the decision? I mean, I love doing these interviews because everything is related to everything else. And where people end up and how they do, whether it's a flip of the coin or an opening that occurred, etc. But who inspired you? It may have been in another field, may have been your father. It doesn't have to be a plastic surgeon.
I think that in the course of my career, really there are probably 4 people that were my mentors. Can't narrow it down beyond that, but certainly Steve Arian at Yale, the chief at Yale. And then I was lucky to do my hand fellowship with Joe Upton. And
I know Joe He trained in Houston.
Yes. And Joe was a fantastic hand surgeon, and I spent a year doing hand fellowship with him, and then moved on to Children's Hospital of Philadelphia and worked with Linton Whitaker.
Oh, sure.
So tremendously
you had a few icons in your past too, yeah. Yeah.
And then when I took my first job in plastic surgery, it was with John Coleman at Indiana, who also served as a mentor for me.
Okay.
So, I can't narrow it down beyond that, but those 4 people were pivotal. Yes.
The thing I remember about Dr. Whitaker, we attend meetings and people present certain things, was his subperiosteal facelift.
Yes, I remember that. It was on a teleplast, I think.
Yes. Yeah, but he did this, and it was a lot of work, gone a long way for something, and at the end he said, it was tight.
Yes.
I mean, when you go I don't think anybody does that anymore. But that's what I love about plastic surgery. Yeah. We always push the envelope, and we ratchet it back. But I remember him saying, well, she's getting used to her new look. I thought, that's a euphemism. So look, speaking of how plastic surgery is, we've seen momentous paradigm shifts in plastic surgery. And during your career, tell us a little bit about those things that just affected you one way or the other.
Well, as I was starting the field, microsurgery was just coming in as a prominent force, and certainly that was a wonderful thing. And I did a number of those cases early on in my career. I had trained with Joe Upton, and I did a number of microsurgical cases with him. I think that one of the changes that I actually played a key role in, though, was actually an educational change. And so I was lucky enough to be the chairman of the Residency Review Committee. And at that point in time, plastic surgery had sort of a disparate training program in many different places. So there were programs that were 2 years long, programs that were 3 years long, programs that were 5 years long, and programs that were 6 years long. And I still remember that I had been on the residency review committee for just a year, and then I was selected to become the leader. It had to do with the way people change and rotated off and all that. So I remember going to the monitoring committee, which is an arm of the ACGME, and met with the team there, and they said, "Tell me, Bob, how long does it take to train a plastic surgeon?" And I gave them a usual reply about how the programs are various lengths, but they all work together depending on how the case volume is and how the experience is. And I said, this has worked very well. Plastic surgery has been one of the most productive and innovative fields in medicine. And pointed out the Nobel Prize with
Joe
Murray, and as well as other things. And he said, maybe you didn't hear me. Chair said, I'm going to repeat my question. How long does it take to train a plastic surgeon? He said, because you're going to tell us. And so, along with my members who were very elite members of the plastic surgery group, we put our heads together and nose to the grindstone and ended up with an evolution of the current system that we have. And in many ways, that stood the test of time. And we're now over 20 years with that same model.
Now, and it's interesting you bring that up because you're right. That's been it was a moving target for a number of years. Do you do 5 years? Do you do Southwestern went to the combined program, but then you had to make that decision when you were in utero to get a program.
That's
because you had to commit at that point to doing it, which was a great idea. That how many years of general surgery do you need? Right. And how many of plastic, and now the programs have seemed to have found their ground, and of course everybody does a fellowship. It seems so.
I think that's very frequent in today's graduates, yes.
Yeah. Now, I don't know whether it's because they feel inadequate, that they need some more training, but what you did was find what worked to make sure somebody's coming out and didn't go into the emergency room on July 1st of the year and say, holy cow, there's nobody behind me telling me what to do.
Right. No, I think that's true. But I think the real reason why people do fellowships is to gain additional expertise in a facet of plastic surgery they like.
Yeah, well, that's why, and I told you that, and I was just lucky that my hand fellowship was my own design that worked out great. Right. And that was when microsurgery was just coming in. Yes. I'll never forget Dr. Forshey said, we got a problem with Akron Tire Company. Guy caught his arm in a belt. Yeah. And he came in, his arm was literally avulsed from the shoulder. And but it took we didn't have rules at that time. It took 4 hours for the doctor to decide what he was going to do. Wow. It was like you can't. This is not going to work well, one way or the other. Until we decided, you don't save this finger, you save that finger. You don't replant the distal phalanges because that's just going to get in your way, etc. So interesting.
Some few bugs needed to be worked out, but we're yeah.
Okay, well, this next question, it kind of is in sync with that. What do you feel has been the most important innovation in our specialty? You might mention a couple, because since I started this 10 years ago, there have been a lot of changes.
Yeah, the field moves forward. There's no question about it, and that's good. That's what we want, is a field that adapts to the changes and demands and problems that patients have. I think that for me, from my perspective, the biggest changes that have happened have been the development of microsurgery, and I think also maybe a part of my own special interest group, the development of craniofacial surgery. Yeah. I remember when I started out back in 1993, They were just at the dawn of using plate fixation for facial fractures. And so that
wire till then.
Wire. Yeah, wire. And so I think that those two fields during my career have really driven things forward within plastic surgery. I mean, there are also many advances that have been made in aesthetic surgery and contributions that that have moved that focus forward. So,
who was the first craniofacial surgeon that you saw?
the first craniofacial surgeon that I saw was Lynn Whitaker.
Okay.
Yeah. Yes.
Because the time I spent in Houston, the big deal was Tessier.
Right.
He came through, and he was a friend of Cronin's.
Right.
And he'd come through once a year and do several cases. It was interesting. It was interesting enough to me that I didn't know I didn't want to do it. You had to have a full team and everything set up. Right. When I was in Akron, Ian Jackson would come over once a year because Jim Lehman had trained over in Scotland. So
really,
yeah, he did it. He did a fellowship with Millard, and he also had trained with Ian Jackson. They were good friends.
Yeah, so. I know Jim Lehman well, and I've known Ian Jackson after he moved to the U.S. But yeah.
All right, and what do you feel is your greatest professional accomplishment?
I think really, when I look back, I think that contribution in terms of consolidating plastic surgery and focusing it in terms of educational paradigm for the residency programs, I think that's really played a big impact. And like I said, it's largely stayed the method that plastic surgery residents are trained by for the past 20 years. And so I had a lot of help, and I had a lot of great members on my committee, but I think driving that forward and coming to a consensus was well worth the effort. And I look back, and I think from that point, I think that's most important.
How many residents do you have in your program?
We have 15 residents, and we're kind of top heavy. We have 2 hand fellows, a microsurgery fellow and a craniofacial fellow.
Wow.
Yeah. So
that's a lot of balls in the air.
It keeps things busy.
Yeah.
It keeps things interesting.
And the length of the program, you've obviously included other uber subspecialties of plastic surgery, right. But what's the total length of training from the day they leave their internship or come in there as an intern to the day that you give them a stamp and say, good luck?
From the day they come in till the day they finish, it's 6 years.
Okay, see, that's a nice length.
Yeah.
The training of 5 years, 2 years, it almost got to the point that you were a professional student.
Right.
And
so what really changed when we made that change in terms of the program lengths and a new paradigm for plastic surgery was that we had already seen the changes that general surgery was going to make. And so we knew that was that the way they had set it up was less advantageous for plastic surgery, and so we knew we had to make some changes. And in fact, what's evolved since that happened, roughly 20 years ago, is that the program lengths of the many programs have changed. So there are about 220 people who finish plastic surgery every year, and about 160 come through an integrated program, a combined program, and 60 come through an independent program after completing general surgery or another specialty. So that balance has shifted quite a bit.
Have you noticed, as a chief of a department, and I thought about this the other day when I was coming here, is how many private practice programs are there? In the old days, there were. The Akron program, until it became part of the Ohio State program, was a private. Utah was a private. Cronin, Giroux, and Biggs was a private.
Right.
Does that still exist? Because the problem is those guys get older or other things, and then what happens to it? Do they still exist, private practice programs?
Not that I'm aware of.
Okay.
Yeah.
And that's what they used to all be.
Yeah,
Yeah.
that's right.
Okay.
Yeah.
Which is why I love doing this, because I've gotten to see all these changes. I'm just old enough that I've seen all that. What do you feel is the greatest mistake we as a specialty have made?
That is a very difficult question. I think that plastic surgery, its strength is that it continues to respond to patient needs. I don't know that I can necessarily say that it's a mistake that plastic surgery has made, but I am concerned about medicine and the changes that have occurred in the last 5 years in terms of corporatization of medicine and how that influences decisions. And some people even think that that is influencing the way patient care is provided. And I think we may be on the edge or precipice of a change that's not good. And I think that would be catastrophic if the changes go away from being patient-driven.
Okay, so I'm not going to let you out of this one.
Okay.
Well, because when you say that, in my head, I'm thinking, I kind of know what you're talking about,
Yeah.
which is why I got into cosmetic surgery, because managed health care was coming in, and I was the young buck that said, I don't want anybody telling me what I can do. And cosmetic surgery was out, but I had done 10 years of everything. And then I
Yes.
started, and so that would have been 77, 87, when HMOs were just
Right.
rearing their heads, and everybody said, you're not going to tell us what to do. Not so fast, buddy boy, because of what you said. There's power in what they do.
Right.
So is that really what you did? They're telling us what to do in a profession that we've chosen, which is supposed to serve humanity.
I would say that from the time that you started until the time now, things have remained relatively in physician control. Okay. Now I'm starting to see things that change things away significantly from physician control.
Okay, all right. Now, what has been your greatest joy?
My greatest joy has been providing care for pediatric plastic surgery patients. I really enjoy it and take a great degree of gratification out of that work, and find that to be absolutely wonderful experience. And without question, that's my greatest joy.
Who is the plastic surgeon? And he's got TV spots about his program, and I can't think of it, for cleft lip and palate.
I don't know.
All right, he goes over the countries, and now he's
Operation
Smile. Operation Smile. Thank you.
Yes.
I hate when I forget things. Yeah, but that's a full out dedication. I can't remember who it was I talked to. I was hoping someday to get to interview him, but now he's with so much on TV. I mean, they're competing against other people, and that has its own political issues too.
Right. So at Medical College of Wisconsin, we have a little bit different model. We formed a relationship with a university in Columbia.
Oh, wow.
And so we have a bilateral agreement with the University of Santander, which is in what sounds like a small town, which is called Bucaramanga, but actually Buca is about 1.5 million people.
Okay.
So, and we work with the university plastic surgeons down there. And it's been great, and it's been in practice for over 30 years. So every year we will go down there for 2 weeks and provide care for more complex cases. And it's not like we're doing any surgery where we do something and we leave. In fact, we have ongoing care supplied by their plastic surgeons. And then at 1 or 2 weeks out of the year, they will send their residents up to Milwaukee, and we will have the benefit of helping them learn some of the various techniques we use and contemporary plastic surgery in the U.S.
Yeah, and I'm making the assumption that these are more than cleft lip and palate. They may be giant hemangiomas. They may be trauma, microtia. Yeah, right.
Yeah.
Which is really what's so great about our profession. It's all based on principles.
That's right.
Not methods.
That's
you can
right.
figure it out if you know how to move tissue and don't cut the blood supply off.
And that is exactly what I try and teach my residents, is that you have a toolkit. And you want to, with the training, you want to get as many tools in that kit as possible and use those in a given way in a given case. And you don't know what way you're necessarily going to use them, but having that toolkit at your disposal for innovation and solving people's problems is key.
Well, I wish I could attribute it to me, but I read somewhere once, and I always use that whenever I would talk to residents, which is learn principles, not methods. The mind that grasps principles will devise its own methods.
That's right.
Which is what we do all the time.
Yeah.
And that's the fun of what we do. So, that's what makes, for me, was the most enjoyable part, is you're an artist, you're dealing with tissue, but you know the principles and don't violate those, and you should be okay. Can't guarantee the results, but can't guarantee that with anything. Okay, give us, if you could, some words of wisdom for future generations of plastic surgeons.
I would say, along the lines of my previous comment, I would say, learn as much as you can. The efforts that you put into your own education will be paid back over the lifetime of your career. If you have a deficit in an area, then you might want to address that. I truly believe that one of the joys in plastic surgery is to be able to solve what most people would regard as unsolvable problems.
Yeah.
And to be able to, as you have pointed out, to bring in the tools that you have and the principles that you have and solve problems.
Yeah.
And that is a key component. So.
Yeah, well, that's the creative part of what we do, because sometimes nobody wrote about this, but you think, hey, this would work here. And I was lucky at the University of Virginia. Milton Edgerton had just come there. There was a guy, honestly, I love him because he was so much outside the box. Now, some of the stuff he did we would never do today, but that didn't hold him up, because if he had an idea, then he'd pursue it, and it was fun to watch him think.
I'll bet.
So that was a play. If you said, well, I admire, but I met other guys through him that were plastic surgeons.
Sure.
Okay, we're getting close to the end here. So, what predictions do you have for plastic surgery in the next quarter century? And I wrote a note to myself last time: AI.
True. AI is going to play a role, I think. But I think that for plastic surgery, again, I would say the practitioners have to be well trained and, to a certain degree, fearless. And they have to defend the practice and interests of plastic surgery. I think that, unfortunately, in today's complex medical practice marketplace, that we always have people who can do one or two things that we do, but they don't have the full spectrum or the full appreciation of what goes into decision making in more complicated patients.
Okay.
So I think that plastic surgery has to continue to produce very well trained individuals. That has to be a core piece of what we do. And I think that as long as we do that, the field will be fine.
Okay. And the last one may be short, but just any other comments you'd like to make or would like to highlight that you might have thought I missed?
No, I think I appreciate all the questions. I think that people ask me about my choice about plastic surgery, and I can tell you this. I've never regretted the choice whatsoever. The other option I told you was I was going to all set up to do pediatric surgery. And I think that plastic surgery provides such a tremendous career and such a tremendous joy practicing it that I reassure them that they have made a choice that they'll be happy with for the rest of their lives.
Well, I thank you for the interview. I thank you for training other plastic surgeons. And Bob, it's been a pleasure talking to you, okay?
Dr. Levine, thank you.
Thank you. Thank you for watching. And I hope you enjoyed this interview. All of my interviews are available online at meeting.aaps1921.org. Again, that's meeting.aaps1921.org. And thank you.